Good afternoon, everyone. Today, Taylor and I will be presenting the case of Rue Bennett, a 17-year-old female from Euphoria. We'll review her presenting concerns, relevant history, our clinical formulation, and the treatment recommendations we would propose if we were discussing her case as part of an interdisciplinary treatment team. Rue is a 17-year-old female who lives in East Highland, California, with her mother, Leslie, and her younger sister, Gia. Her father passed away from cancer several years ago, and his death continues to have significant impact on her emotional functioning. Rue has a history of severe opioid addiction, multiple relapses, psychiatric hospitalizations, and co-occurring mental health disorders. She has had difficulty maintaining sobriety despite several treatment attempts, which brings her to our treatment team for further evaluation and planning.
Rue's primary presenting diagnosis is severe opioid use disorder, but her clinical presentation is complicated by several co-occurring conditions, including depression, anxiety, ADHD, OCD, and symptoms consistent with bipolar disorder. Throughout the series, Rue experiences repeated relapses, overdoses, and emotional instability. Although she understands that her substance use is negatively affecting her life, she demonstrates limited motivation to remain sober for extended periods. Her mother has become increasingly concerned because of Rue's risky behaviors and repeated medical emergencies related to substance use. Given the complexities of both her substance use and mental health symptoms, we believe an integrated treatment approach is necessary.
Looking at Rue's background, her substance use began after being exposed to prescription medications while helping her care for her father during his battle with cancer. Following his death, she experienced significant grief, depression, and anxiety. Rather than processing those emotions, she began using substances as a way to cope. Over time, her use progressed from prescription opioids to fentanyl, alcohol, cocaine, and other substances. This has resulted in multiple overdoses, withdrawal episodes, psychiatric hospitalizations, declining school performance, and strained family relationships. Academically, Rue struggles with attendance, concentration, motivation, and completing assignments. Her addiction and psychiatric symptoms have made it difficult for her to function consistently in school or begin planning for her future.
From a family perspective, Rue lives with her mother and younger sister. Since her husband's death, Leslie has been raising both children on her own while trying to manage Rue's addiction. Although there is a strong sense of love within the family, their interactions have become increasingly dysfunctional. Leslie frequently rescues Rue from the consequences of her addiction out of fear and losing her, while Gia often receives less attention because the family's focus remains on Rue. It's important to note that there is no indication of physical or sexual abuse within the home. Instead, the family appears to be struggling with unresolved grief, chronic stress, un and unhealthy patterns that have developed around Rue's addiction. Socially, Rue has also limited protective supports. Many of her peers either use substances themselves or have easy access to drugs, increasing her risk of relapse. While Jules is her closest emotional support, that relationship is often unstable and emotionally intense, making it difficult to serve as a consistent source of recovery support.
Reviewing her treatment history, Rue has participated in inpatient rehabilitation, outpatient treatment, individual counseling, psychiatric care, and recovery meetings. While she has experienced brief periods of sobriety, her engagement in treatment has been inconsistent. Much of her motivation appears to come from family pressure rather than internal readiness for change, which may explain the repeated relapse cycle. Because of her chronic substance use and co-occurring disorders, we believe ongoing treatment will be necessary rather than short-term intervention alone.
Our case formulation is based on a psychosocial approach combined with family systems theory and cognitive behavioral therapy. From a biopsychosocial perspective, ruse addiction appears to result from the interaction of biological vulnerability, untreated mental illness, unresolved grief, environmental influences, and family dynamics. Her father's death was a significant traumatic event that intensified her psychiatric symptoms, and substance use became her primary method of coping with emotional pain. From a family systems perspective, the Bennett family has adapted around Rue's addiction. Leslie has assumed the role of the codependent caregiver, often protecting Rue from natural consequences, while Gia has taken on the role of the lost child, withdrawing emotionally as family attention centers on her sister. These roles are understandable, but they unintentionally reinforce the addiction cycle and prevent healthier family functioning.
CBT also helps explain Rue's continued substance use. She experiences persistent negative thoughts related to hopelessness, guilt, grief, and low self-worth. Those thoughts trigger emotional distress, which she attempts to manage through substance use. Although drugs temporarily reduce emotional pain, they reinforce maladaptive coping patterns and ultimately worsen both her addiction and mental health symptoms.
Based on this formulation, our first treatment goal would be sustained sobriety. We would recommend that Rue participate in an intensive outpatient program 3 times per week for 6 months, attend weekly CBT sessions, participate in at least 2 Narcotics Anonymous or Smart Recovery meetings each week, and develop a detailed relapse prevention plan that identifies triggers, coping strategies, and emergency supports.
Our second goal would focus on improving emotional regulation and reducing symptoms of depression and anxiety. To accomplish this, we would recommend weekly dialectical behavioral therapy or DBT because it teaches mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. We would also recommend a psychiatric evaluation for medication management, along with daily coping strategies such as journaling, grounding exercises, and relaxation techniques.
Our third goal would involve strengthening family function. We would recommend biweekly family therapy sessions focused on improving communication, educating family members about addiction and codependency, establishing healthy boundaries, and creating consistent household expectations. Weekly family meetings could also help improve communication and accountability within the home.
In addition to therapy, we would recommend several services. These include medication-assisted treatment, if clinically appropriate, grief counseling, psychiatric medication management, school counseling, peer recovery support, and family education programs. We would also encourage Leslie and Gia to participate in Alcohol Anonymous or similar support groups to address the impact of addiction of the family. Finally, coordination among the therapist, psychiatrist, primary care provider, school personnel, and recovery specialists would be essential to ensure continuity of care.
To conclude, Rue's case demonstrates the complexity of treating adolescents with co-occurring substance use and mental health disorders. While opioid addiction is the primary presenting concern, it cannot be treated in isolation from her grief, trauma, psychiatric symptoms, and family dynamics. As a treatment team, our recommendation would be a comprehensive, multidisciplinary approach that addresses both Rue's recovery and the functioning of the Bennett family. Continued assessment and regular revisions to the treatment plan will be essential as her needs evolve over time.
And at this time, we'd like to open the discussion to the treatment team. We'd appreciate any feedback or additional recommendations you believe would strengthen Rue's treatment plan or improve her long-term prognosis. Thank you, everyone.
Thank you.